Uh, Rumin, we can switch on the video now. We are live on the YouTube. Yes. So, uh, good morning, friends. Welcome back to Saturday Club morning meeting after a little break due to Diwali festivals. So, to start the new year, we have a very eminent speaker with us, Dr. Rumin Shah. He has been a guest speaker to our Saturday Club several times in the past, and we all know him as a very good speaker. To briefly introduce him formally, he is a consultant senior physician with more than 35 years of practice in Vadodara. His areas of special interest are diabetes, non-invasive cardiology, hypertension, dyslipidemia, obesity. And he's involved as faculty and organization of academic programs in various associations like IMA, API, etc. Of course, he's a very popular speaker at various academic fora. He's an avid reader and a marathon runner and a book reviewer. He's a regular book reviewer for Book Browser Club of Baroda. So today he is going to review a book titled Desperate Remedies, Psychiatry and the Mysteries of Mental Illness. So over to you, Dr. Rumin. You may speak for about 40-45 minutes and we'll have some 10 minutes of interaction. So over to you, Rumin. Thank you.
Am I visible now?
Yes, Rumin. It's
Hello.
well seen and your voice is audible.
Good morning. Very happy New Year. It's a pleasure to review this book. Thank you, Satish, for a very nice introduction. It was in one of the issues of Lancet in 22 that this book was reviewed. Lancet being a journal which does not review books so regularly. I was curious to know more about these books, read about it at various places and realized that it's worth reading. So that is the book Desperate Remedies by Andrew Scull. So we all have been seeing a huge surge in psychiatric illnesses all over the world, irrespective of the ethnicity, irrespective of socioeconomic status, and so on. So it's high time we know more about the evolution of psychiatry as a science. We have seen lots and lots of cover stories on psychiatric issues in various US-based magazines. But even India, we see a huge surge in incidents of anxiety, depression, and suicidal tendencies. And it was Deepika who actually came out and showed courage that she went through a phase of depression that made things a little better for psychiatric illnesses in India. So we see there are a large number of psychiatric disorders with huge prevalence right from the age of 5 to 9 years up to the age of 95 years. So one, there is huge panorama of psychiatric illnesses, one, and two, they're prevalent over various ages also, and that therefore we ought to know how the evolution of psychiatry and the psychiatric diseases and the management occurred. The book was published in 22. It has 484 pages. Almost 100 pages are devoted to references. There are huge references from medical journals, references from literature, and so on. The main book has 388 pages. The author has done immense research, spent a huge man hours to write this book. The book is divided into three parts. Part one deals with the past of psychiatry, the asylum area, and there are some 11 chapters in that part one. Part two deals with disturbed minds, the etiology, so as to say, and the realization of how psychiatric illnesses work. And part 3 deals with psychiatric revolution, and there are 6 chapters on how the psychiatric field has changed in last so many years. Now, Andrew Scull, the author, is a distinguished professor of sociology at University of California, San Diego. He did his bachelor's from Oxford University, then moved to USA. A British guy moved to USA, did his PhD at Princeton, and he taught at University of Pennsylvania and Princeton before moving to UCSD. Has been an acknowledged author. Has been a president of the Society for the Social History of Medicine. Has received innumerable awards and has, to his credit, a number of books on psychiatry. Look at the books that he has written: Madhouse, Hysteria, Museums of Madness, Psychiatry and its Discontents, Madness. And there are further books like Madness in Civilization, The Insanity of Place, and Masters of Bedlam. So he has written close to 10 books and numerous scientific papers in various peer-reviewed journals. And that shows the authenticity of the author. Now, the first part that he deals is the part of the asylum area. He deals with how mental hospitals became the first phase of psychiatry in the world. The first sentence that he writes is that American psychiatry, like its counterpart in Europe, was a profession born of asylum. So the birth of psychiatry as a specialty, as a science, was in asylum or a mental hospital. In those days, insanity, psychiatric illness, madness was considered a symptom of degeneration, so-called biological inferiority. When Darwin showed us what evolution was, in those days it was believed that when you evolve in reverse direction, this leads to madness or mental illness or psychiatric illness. It was believed that heredity plays a major role, leading to structural and physiological defects in human being. These people who were psychiatric patients were considered to be biologically defective. They were considered to be waste products of evolution, fit only for excretion. It was believed that when you have committed a lot of vices and done a lot of immoral works, you will end up being insane. They were labeled as degenerate human beings. They were considered to be obstacle to chain of progress of human society. And it was necessary to purge them, the living persons, out of our system by whatever way we could do, preferably a gentle, painless death. So when patients were, or psychiatric patients or mentally unstable patients were admitted in sanitarium or mental hospitals, the whole idea was to isolate them. They were given various drugs depending on their symptoms, but most of them were placebo. The rest was a major therapy. Then they were given dangerous tonics like morphine, cocaine, strychnine, animal extracts, hydrotherapy, and electrotherapy. It was a completely unscientific but prevalent treatment in those days. If you look at the patients were treated in appropriate physical and moral surroundings, and it was believed that when you put such mental patients or such mentally sick patients in a mental hospital, they could be cured very easily as you could cure common cold. The doctors who used to treat such patients were known as alienists. And if you look at number of inmates of mental hospitals, in 1903, there used to be 150,000 inmates in mental hospitals in USA. In 1950, that number rose to almost 400,000, 500,000 patients. If you look at the patients who used to stay, 75% of patients used to stay for more than 2.5 years. 50% of patients were in mental hospitals for more than 8 years. And 25%, one-fourth of such patients used to be in mental hospitals for more than 16 years. Imagine a patient just being in mental hospital for 16 years. An average stay of a schizophrenic patient in mental hospital was 10.5 years. So this was, in fact, the United States law was very stringent as far as mental illness was concerned. 31 states prohibited mentally ill from marriage. If at all somebody was found out, there was a 3 years imprisonment. Special immigration laws, which were so far were liberal, were enacted to stop ignorant and brutal peasantry coming from Europe to USA and diluting the wise US population. There was, in fact, complete barrier as far as Asian immigrants were concerned, because Asian immigrants were more likely to be insane than European immigrants. If at all immigrants or NERD patients were admitted in mental hospitals, there were special rooms for them. They were kept aside, they were kept and given different treatment. Most of those patients who were admitted in mental hospitals were subjected to ruthless involuntary sterilization without their consent, so that they would never be able to procreate. At that point of time, Seventh-day Adventist Church, the West, established a mental asylum known as the Western Health Reform Institute in 1866. It was believed that visions from angels, the messages of Christ and Jesus Christ and God, was helpful in treating such patients with little bit of help of diet, enema, and so on. Believe me, this was the most popular mental hospital in those days. This was the largest hospital, the most famous sanatorium in the world in those days. Later on, it was taken over by Kellogg Brothers, and I'll show that in future slides. Now, from that era of mental hospitals, science had to come out. From archaic beliefs to science, it was Dr. Emil Kraepelin, a German scientist who is rightly called father of modern psychiatry. He was the first who said that no, till then it was believed that all psychiatric illnesses were spectrum, some very mild, some very moderate, and some severe. He said no, psychiatric illnesses are different, and he classified them into either dementia precox, so-called schizophrenia as of today, and manic depressive psychosis or bipolar disorder. So it was the first ever attempt to classify psychiatric illnesses. Kraepelin was nominated for the Nobel Prize 8 times over a period of 17 years, but he never ever could get Nobel Prize. His protege, his student, Adolf Meyer, again a German, a Swiss German, migrated to USA in those days for better money, and he brought in era of science in psychiatry. He told that mental illness is just a brain disease. There is no degeneration. It arises from brain. He believed and he convinced people that it was failure of functional adaptation of a human being to demands of modern life. In those days, there was a large prevalence of general paralysis of insane, a complication of syphilis. And it was believed that just like syphilis, the germ of syphilis causes madness, some form of auto-intoxication, some form of self or inflicted toxin will lead to mental illness. He brought in the era of common sense psychiatry. That means believe in science, believe in well-being of the human being. He was the first who focused on a very detailed history of psychiatric patients. He believed in elaborate records and facts, and this in turn became basic of established psychiatric practice. He was a bitter critic of mental hospitals. And he clearly told that if you want a mental patient to get benefits, he has to escape from confines of asylum walls and go to people and make it a common man psychiatry or a social psychiatry or a community psychiatry. And then came the era of germ theory for psychiatric illnesses. Well, as we discussed, GPI was one which showed mental illnesses. That was an era of bacteriological revolution. Bacteria were and antibiotics came into work, and it was believed that germ theory, some germs were responsible for mental illness. And Dr. Henry Cotton at Trenton Asylum, New Jersey, realized that the only way to cure a mentally ill patient was to remove some focal infection, a low-grade infection. He believed that some infection somewhere in the body, some corner of body, was responsible for releasing toxins, which would then get spread all over body and lead to psychiatric diseases. And therefore, he believed that madness is a terminal symptom of long-term sepsis. It's mask infection, toxemia, which in turn leads to brain cell damage. He first started removing teeth for cure of mental illness. Then it went to tonsils, sinuses, spleen, stomach, colon, genitourinary tract, cervix, whatever was available, he would remove that. In fact, he himself did 250 colectomies for curing mental illness. If there was a failure, if there was a suboptimal result in treatment of mental illness or recovery, he would say that, sorry, we did not remove your whole colon, or sorry, we did not remove your kidneys, and we did not remove your uterus, and so on. So he believed that when you do suboptimal surgeries, you will not get results. In fact, he was labeled as Joseph Lister of psychiatry. He was the one who brought a desperate but a frontal attack on whole field of sepsis. He in fact subjected his wife to tooth extraction. One of the sons had mild constipation. He removed the colon of that patient. Unfortunately, both the sons of Dr. Henry Cotton committed suicide. And although his therapy was completely bogus and a fraud, American Journal of Psychiatry, the respected journal, wrote an obituary that thousands of patients who have suffered from mental affliction owe him an enduring debt of gratitude for displacing despair with hope and confidence. His has been a man who was a man of action and results, and his loss has been an outstanding and premature loss. So that much was the respect given to a man who propagated fraud. Retrospectively, now people have been reading about him and then write that he was not only a bad surgeon, he was a butcher, and he has been rightly criticized. Horrifying curse of Dr. Henry Cotton, America's biggest quack. And as you see, he performed over 645 twisted operations trying to save the mentally ill, actually making them more miserable. After this germ therapy came fever therapy. Fever therapy, it was believed that when a patient of syphilis with GPI had fever, and if you treat this patient with malaria or inducing malaria, either with a blood of a malaria patient or a mosquito bite, there would be a remarkable improvement. None of the alternative febrile agents were as convenient, as effective as malaria. And this was considered as the first major biological treatment of mental illnesses. Now, why do I waste your time on showing this? Because it was this therapy that was propagated by Wagner Jurek, and that gave him, or that was the first ever Nobel Prize given in field of psychiatry. Nobel Prize for discovering malaria therapy for GPI and for further therapy of mental illness. Gentleman received a Nobel Prize for his discovering of malaria therapy for mental illness. And then came era of insulin coma. We all know insulin leads to low sugar. When there is a high dose of insulin, it leads to hypoglycemia. Manfred Sekel, he was a physician from Poland, and he thought that if you bring about severe coma in a patient of psychiatric illness, give the patient insulin, bring down the sugar. Insulin had just come into market in 1922 and started giving wonderful results. So these gentlemen decided that let us start with this. So sometimes patients were subjected to this hypoglycemic coma 5 to 6 times a week, and patients individually also underwent coma therapy for 60 times or more. In fact, it was supposed to cure patients of all mental illnesses. Reader's Digest and Time in those days labeled this as a bedside miracle. In fact, 72% of 305 mental hospitals in those days practiced insulin coma as a treatment of mental illness. Although low sugar led to brain damage and sometimes irreparable brain damage, when the proponents of coma therapy were asked this question, the answer was that the mistake in theory is not against treatment. Theory may show damages. In practice, we see a lot of patients benefiting from insulin therapy. Textbooks of psychiatry had chapters on coma therapy, and in fact, there was a special issue of American Journal of Psychiatry on insulin coma therapy in psychiatry. It was considered as a bloodless revolution in which patients were cured of psychiatric illness with just inducing hypoglycemia. Came era of shock therapy or electroconvulsive therapy. Dr. Ugo Celeriti, an Italian, was the one who realized that giving current, inducing convulsion would be a brutal attack. Psychiatric illnesses anyway are bad, and you need to attack them brutally. Like a dynamite, you blow the whole pathology out. Once you put the patient on electroconvulsive therapy, like a dynamite, it blows away the pathology, and thereafter everything then becomes normal. The first drug that was tried was metrazole, and it led to convulsion, and it gave good results. And then it was extrapolated, and electroconvulsive therapy came into effect. And thereafter, it became a most frequently used active treatment. It is also labeled as annihilation therapy, a therapeutic discipline of brain. It reduces patient from being very aggressive and very rowdy patient to an infantile level. The patient would then pass from being very aggressive to a state of confusion, amnesia, and complete disorientation, so much to the liking of mental asylum superintendents. It used to erase existing memory and reprogramming brain. That was a belief in those times. Some patients were given even close to 100 electroconvulsive shocks. The side effects like fracture were seen but were neglected, and some placebos were added to avoid those side effects of ECT. And thereafter came era of regressive ECT, or a milder form of ECT. Electroconvulsive therapy used to lead to amnesia lasting 5 to 10 years. Sometimes, as we discussed, 60 ECTs were given. Sometimes patients were subjected to electroconvulsive therapy twice a day. Sylvia Plath, a well-known author, and Ernest Hemingway, both of them underwent electroconvulsive therapy for depression, and psychosis. And what did Ernest Hemingway write? He said that what these shock doctors don't know is about writers, and what they do to these writers with electroconvulsive therapy. What is the sense of ruining my head and erasing my memory, my capital? That's what Ernest Hemingway wrote. And soon after that, he committed suicide following electroconvulsive therapy. And then came era of psychosurgery. It was believed that the treatment that was given so far was okay. There was some progress in psychiatry, but nothing close to removing part of brain. So cutting sick part of human personality, cutting sick brain was considered as a treatment option. And Egas Moniz, a Portuguese surgeon from Lisbon, who won 1949 Nobel Prize, the second prize in Nobel Prize in psychiatry, was a pioneer of this therapy known as lobotomy therapy. Here, it was believed that mental life is a small circle of thoughts. These thoughts, which go on recurring, master all others. They recur again and again in the brain. And therefore, if you can stop these thoughts to a brain which can always stand a good deal of manhandling, you could benefit the patient. Severing the connection of neurons was considered to be the treatment of choice. Altering the frontal lobe modified the personality of subjects. It was also labeled as a happiness cut. So when you cut the frontal lobe of the patient, you are offering happiness to the patient. There were a lot of modifications in original surgery, which was started in Europe. And there was something known as precision lobotomy. A butter knife-like instrument was used for sweeping cuts of brain of both the sides. And some patients who did not respond to first operation were subjected to second or even third lobotomy. Now, this lobotomy was labeled as one of the greatest surgical innovations of this generation. It was labeled as shining example of therapeutic courage, as it was known as it cuts away sick part of human personality. It was labeled as a personality rejuvenator and a milestone of modern medicine. Unbelievably, but rightly, it was considered the foremost method for the chronically mentally ill patients. And Dr. Walter Friedman in USA was a giant who did lots and lots of transorbital lobotomy. He was also labeled as Henry Ford of lobotomy. He had his own car, which he labeled as Lobotomobile. And with his car, he moved all through USA to propagate, to promote the science of lobotomy. He himself did 400 lobotomies. And if you look at various places in Howard Hospital, Harry Solomon did 550 lobotomies in psychiatric patients. Mayo Clinic, 250 lobotomies were done in treating psychiatric patients. McKishock did 500 lobotomies. From 18 months in July 51, some 12,000 plus lobotomies were done in USA. The number of lobotomies done in UK was 1,100 per year. Lobotomy used to create partial euthanasia and was thus giving rise to some amount of relief in psychiatric illness. But then came era of newer modalities of neurosurgeries. Neurosurgeons started getting good work in various other parts of the brain. And therefore, it was realized that this was a rubbish therapy. And although children up to the age of 4 years were subjected to lobotomy, and in 1950 it was believed that lobotomy was the best tool to cope up with mental illness with a gender bias towards females. It was later on labeled as a mutilation, not an operation. The patients were made domestic invalid. That led to realization of lobotomy delusion, and advances neurosurgery realized that this was a treatment which had to be thrown away. And later on, it went out of vogue in Dr. Friedman, the gentleman who did so many surgeries, lobotomy surgeries. Three of his 3 sons are psychiatrists practicing in USA. All of them are practicing modern psychiatry, but they are very much protective of their father's legacy to psychiatry and believe that the treatment, although outdated, had its own role in those days. So it was end of an affair in which lobotomy was then later on criticized. Lancet did a review of lobotomy and then realized that lobotomy was not the right treatment, and therefore there was a time to get it out. And in 1950 or so, it started getting out. The second part deals with disturbed minds, advances in genesis of psychiatry and therapies in psychiatry. It was believed then that madness is a continuum from psychoneurosis to psychosis. It was good to ship patients from institute care to outpatient or home care. The first time USA realized that mental health was an issue, and National Committee for Mental Hygiene was established. There was an active promotion of mental health and hygiene. Universities started getting psychiatric departments. Till then, there were no psychiatric departments. And Rockefeller Foundation, which realized there was a huge lacuna in American medical science and in psychiatry, started pushing and giving funds for development of psychiatry and internal medicine. How can we forget the contribution of Sigmund Freud? Sigmund Freud was the one who started a revolution in psychiatry by resorting to psychoanalysis. At the age of 53, in 1909, he took a steamer aboard a ship to go to USA. From Austria, he went to USA and started talking about his belief of psychiatry. And he told that libido, the unconscious sexual drive, was the central psychological underpinning. He was a trained neurophysician, and he said that libido was the central psychological underpinning for all human beings, leading to all discomforts and disturbances and repression, which was there in the unconscious mind, led to psychiatric manifestations and thoughts and behavior emerging from such tension of unconscious mind, unconscious motives leads to psychiatric illness. And therefore, a painstaking detailed history, a good interview was very much important. His idea was considered in USA as a futile idea. It was considered that there was nothing great in what Freud said. And he also realized that America was not for him. And he himself told that America is a gigantic thing, but it is a gigantic mistake. He said America is anti-paradise, populated by savages and swindlers, and ought to be renamed as Dolaria. So this was his experience of the first and only trip that he did to USA. It was years ahead. His theory was years ahead. The benefit of his teaching went to his protege, Carl Jung, whom he labeled as crown prince and successor. And he recommended analytic psychology, community psychology. And therefore, because his approach was a little milder, he became very popular in USA and started getting rich patients, McCormick and Rockefeller, and they paid him huge amount of money for psychiatric counseling. So although he propagated the idea of Sigmund Freud, it was he who became extremely popular in USA. And in those days, in USA, the idea of psychoanalysis was considered as stupid. And Journal of American Medical Association wrote an editorial that psychotherapy, the sense and nonsense, and ridiculed the idea of Sigmund Freud. But Freud's idea, that tension between individual and civilization, leading to repression and leading to sexual repression, was the reason behind psychiatric problem, was later on accepted all over the world, so also in USA. And then came this era of psychoanalysis, in which, as a detective, psychiatrist used to decode human behavior by taking detailed history, uncovering hidden motives, stripping away surfaces and disguises, revealing secrets of souls. And therefore, there was a huge migration of psychoanalysts from Europe, who were hounded because most of them were Jews, led to a psychoanalytic or psychoanalysis as an established treatment in psychiatry. And it was the sea change in belief of psychiatry was brought in by 1942 World War. Large number of US troops were admitted with disorders, and the incidence of psychiatric illnesses was 2 to 3 times higher. So almost 25% of admissions were because of psychiatric cases, and 40% of sometimes them occupied the hospitals because of psychiatric illnesses. And so the first time that it was believed that not only mental makeup, but environmental factors, the surrounding, was also responsible for psychiatric illnesses. And when soldiers started complaining of mental disturbances. The stigma around psychiatry started going away. And there then came era of psychoanalysis, counseling, and psychodynamic psychiatry. So there was a professional transformation. There was wider acceptance of Freud. Psychoanalytic ideas were considered as part of therapy. There was again a huge increase in number of psychiatrists in USA. In 1948, there are only 5,000 psychiatrists, which rose to 27,000 in 76 and 57,000 in 2020. There was a shift to home care, and there was disappearance of mental hospitals and public psychiatry because population did not want the government to sponsor mentally ill because it was a huge wastage and expenditure. And when psychoanalysis of Freud was propagated, they realized that you need to mellow down a little bit because there was a lot of connotation in Freud therapy as far as sex was concerned. And therefore, it was believed that you have to get out of psychosexual elements and pessimism of Freud and start looking for some other issues. And then came the era of cognitive behavioral therapy. It was believed that conflicts and unconscious drive led to changes in human behavior, and that led to an era of cognitive behavioral therapy in which it was believed that you need to aim only at certain aspects of mental illness. The interviews that you do in cognitive behavioral therapy would be smaller, more focused, cheaper, and therefore this became a practical way of treating patients of psychiatric illnesses, and that has been taken over by a lot of psychoanalysts. The part 3 also discusses about psychiatric evolution and the present and future of psychiatry. He first of all lists the unmet needs in psychiatry. Psychiatry was always considered as medicine's ugly child. It was always far away from general medicine. And it was one of the most backward fields of science. Not the finest minds were working in psychiatry, and scientific methods were very difficult to apply in psychiatry, and therefore this needed to be corrected. And then came era of psychopharmacology. Ron Polnick and SKF had started marketing Phenergan as an antihistaminic, and derivative of that, phenothiazine, in 1950 was tried in some psychiatric patients, and it was a serendipity. It was an accidental try, but chlorpromazine, a derivative of Phenergan, did help and reduce hallucinations, delusions, abnormal thoughts. Although it was considered as a bogus drug in USA, it was widely accepted in Canada, and it became a blockbuster and the first recommended psychiatric therapy in the world in 1950. Mepromet was another minor tranquilizer. Oxycontin, tranquilizers, lithium, they all came into picture later on. John Cade in Australia actually started using lithium, which was not accepted in USA till 1970, but again, it was one of the treatments for mania. Sackler dynasty or Sackler family was the one which marketed a lot of psychiatric drugs, and they made it possible for Oxycontin to be available to US population, in turn leading to a large number of US patients, people becoming addicted to this drug. It was believed that the onus of treating psychiatric patients was not on government. And although patients used to stay in mental asylums, they were more like prisons or warehouses for unwanted. There was a tremendous hit of public provision of mental hospitals and the payment of government. Government wanted to save money. People did not want to pay taxes for mental hospitals, and therefore asylum care has almost now gone out of fashion, has been replaced by home care and street care as far as community psychiatry is concerned. There was a huge dilemma in diagnosing mental illnesses. There were no uniform standards like you have in blood pressure or diabetes. It was believed that mental illness was a myth. Schizophrenia was considered as super sanity. It was considered as a voyage of discovery. It was a phase in which had to be indulged. You had to discover yourself and therefore there was a wide variation in diagnosis across the same hospital, same country, and same continents in psychiatric illness. Dummy patients were sent to different psychiatrists, and all of them would come out with different diagnoses, and therefore some form of uniformity was needed. In fact, there was this is that book by Susanna in which she mentions how one guy pretended as a patient and fooled a lot of psychiatrists in academic circle. But it was the first realization came when post-traumatic stress disorder was detected in Vietnam War veteran. And there was an editorial called Post-Vietnam Syndrome. And there was a pressure from patients to include this as a psychiatric illness. The government refused to accept this as a disorder. And therefore came this era that although trauma and its effects on psyche are known, past horrors can lead to a major outcomes. Post-Vietnam Syndrome was a reality, and therefore, because of the psychic scares of in modern world, it was necessary to label a disease. And then came this era of diagnostic and statistical manual of mental disorder. It was realized that the diagnosis was vague. A disease like post-traumatic stress disorder was not realized, and therefore they started publishing diagnostic and statistical manual of mental disorders. This is the 5th edition, which now is sort of a Gita for diagnosing mental illnesses, and that gives uniformity of diagnostic standard and uniformity of treatment. And this is an answer to all the criticisms about psychiatric illnesses. It was discovery of dopamine by Arvid Carlsson from Sweden, giving him the 3rd Nobel Prize in psychiatry, which realized that there was some era of psychopharmacology. And then there came realization of serotonin as a chemical. So psychopharmacology in terms of treatment of depression, anxiety, psychosis, mania, and ADHD came into vogue. Antidepressants like tricyclics, SSRIs, selective serotonin reuptake inhibitors, benzodiazepines, psychotic drugs, lithium, amphetamine came into practice. The author devotes 2 chapters to these drugs, devotes a lot of discussion on the various trials taken, the effects of the drug, the outcomes of the treatment, and so on. He's pretty skeptical of the trials of these drugs and believes that although most of the drugs do give relief, the relief is partial, and there are number of side effects to be countered. But all said and done, this has given good results, and drugs which are now available in psychiatric armamentarium have changed the treatment. In fact, Prozac, the first fluoxetine, the first so-called widely available antidepressant, became a sensation. Lots of books have been written about Prozac and Americanization of Prozac. So also drugs like Paxil or paroxetine and risperidone used in psychosis. But if you look at the prevalence of psychiatric illness in America, the prevalence of psychiatric illness has gone up from 3.3 to 7.1. 17.3 million Americans, adults, have major depression. 3.2 million adolescents between 12 and 17 have depression. Aripiprazole, oh God, so what has happened? Oh, sure. Oh, sorry.
No, it was, we were able to see it well, I mean.
No. Okay, it is just one. Okay. So there is just, so a lot of drugs. So there is a 44-fold increase in ADHD in USA. 92% of ADHD drug expenditure in world is in USA, and large number of children now have ADHD. So this is the wide prevalence of psychiatric illness, and the same amount, if you can extrapolate, occurs in India also. There are one whole page a whole chapter devoted to psychiatry and pharmaceutical industry, and he has shown that chlorpromazine changed the fate of SKN. The revenue from 53 million went up to 196 million. Librium and Valium from Roche changed its complete out profit margin, and it netted almost 200 million in 1977. Abilify generated 7 billion rupees. Clozapine and Risperidone generated 14.6 billion as far as the profits were concerned. So psychiatric drugs have become blockbuster and earning drugs for a lot of pharmaceutical companies. There is a tremendous gender bias in psychiatry. Females in general had to undergo a lot of major humiliation and bad treatment as far as psychiatry was concerned. Twice as many shocks were given to females, twice more lobotomies were done in females. 85% of psychosurgeries were done in females, and men were 30 times less likely than women to be bound in camisoles or bales. And that was a tremendously negative part of psychotherapy. There was a huge contribution of Jews, Germans, Europe, and Australia in progress of psychiatry, which has been discussed in one chapter. And psychiatry could not have been what it is without the immense contribution of Rockefeller, McCormick, Kellogg's, and Sackler. And there is a very interesting story about Kellogg. Kellogg's were the one who realized that there was a market of psychiatric hospitals. So they took over a psychiatric hospital, started managing a mental hospital, realized that they could offer some food to them. The food which they offered became so popular that those who could not afford a mental hospital started buying their breakfast cereal, and then they diversified into breakfast cereal. So psychiatric hospital or a mental hospital was where Kellogg's cereal came out of and made them a huge profit-making people. What about entertainment industry? We have seen that David Selznick, Gone with the Wind, after that success became highly depressed and did seek treatment. One Flew Over Cuckoo's Nest was actual experience of electroconvulsive therapy and become a huge blockbuster. Alfred Hitchcock made a lot of movies on psychiatric themes, and we have Indian movies with psychiatric themes. If you look at progress in psychiatry over last 2 decades, the alienist has now become a psychiatrist. A Simple Madness now has 383 different disease names. Asylums have completely gone. There used to be 500,000 in 1955 inmates in asylums. Now it has gone down to 54,000. Sham or useless therapy has now been replaced by drug therapy, psychotherapy, cognitive behavioral therapy. Past dangerous coma has now been taken over by safer therapy. Surgical lobotomy is now replaced by chemical lobotomy with the help of drugs. Anecdotal practice has become evidence-based therapy. From psychotherapy to psychodynamic psychotherapy to cognitive behavioral therapy, there is a huge progress in psychotherapy. And psychiatry, which was a poor cousin of internal medicine, now has become resourceful, evidence-based medicine. And if you look at 2 major quotes, psychiatry now has moved from a bio-psycho-social model of mentally disorder to a bio-bio-bio model, emphasizing that there is a great emphasis on mental and brain for the genesis of psychiatric illness. And Leon Eisenberg from Harvard told that profession has traded one-sidedness of brainless psychiatry of the past for that of a mindless psychiatry. So in past, it was believed that brain was not resourceful. Now it is believed that brain is the major reason of psychiatric illness. In fact, now psychiatry is considered as very much in thing, and in this very nice book, Nazir Gami shows that a lot of leaders who have been successful in the world have some amount of madness inculcated in them, and therefore psychiatry will progress through genetics, through more neuroscience research, and some amount of pharma support. I will end by just 2 slides that he writes last chapter of epilogue, and which he writes that treatment success, although is seen, it is not commensurate with better diagnosis. Ineffectual treatment is still there. There are major side effects of antipsychotic drugs. Psychopharmacology has a slow progress. In last 30 years, no major drug has been found out. Cognitive behavioral therapy has its limitations. The pharma industry is not so aggressive in its research. Public psychiatry has completely gone, and government support has been very minimal. Brain spot psychiatry is now the major thing, and now mental illness is considered as brain disease. Developmental, environmental, cultural, and social factors are crucial elements in mental illness and its various manifestations. Psychiatry, according to Eisenberg, is all biological and social. No mental function is possible without brain, and in particular social context. He says to ask how much of mind is biological and how much is social is as meaningless as to ask how much of the area of rectangle is due to width and how much is due to height. In fact, emphasizing that both the brain and the surrounding milieu has to be given a lot of importance. Mental pain is less dramatic than physical pain, but it is more common and harder to bear. And major mental illnesses constitute some of the most profound forms of human suffering, at once the most solitary of affections and the most of social maladies. And therefore, the author ends with William Shakespeare's quote, "Disease is desperate growth." That is how he has brought this title of the book. Disease is desperate growth by desperate appliances are relieved or not at all. That is what William Shakespeare wrote in Hamlet. And that is why he says that desperate remedies and major psychiatric illnesses are now very well treated, well appreciated, but there is still a long way to go. I thank you for your patience, and I hope I have justified and not wasted your time. Thank you so much.
Not at all, Rumin. It's always a pleasure to listen to you. And you so beautifully, summarize the whole book. I mean, so many dimensions of psychiatry that you tried to give in a short time of 40-45 minutes. A wonderful, comprehensive book review. And we have really come a long way. I mean, looking at the first 15-20 minutes of your talk, the history of psychiatry was also very interesting and very informative talk. Now it's open for questions. Yes.
Can I say something?
Yes. I know Dr. Shukla is a psychiatrist practicing in USA. Yeah, please.
Yeah, now I have retired, but Dr. Rumin, it was an excellent presentation. And as a psychiatrist, it is nature and nurture both. And you give a perfect history, very detailed. And I started ruminating about my practice. But about Kellogg, I have to say something that Kellogg breakfast is so common. But breakfast is now considered one of the worst meals of the day because hormones are high in the morning and it breaks your fast early. And 95% of serotonin is produced in the gut. And this sugar and this carbohydrate that destroy the gut bacteria. And there is another disease known as SIBO, small intestine bacterial overgrowth, because large intestine bacteria, they don't get any food because we make flour out of grain. So they migrate to small intestine and cause diseases. So for Kellogg cereals to become so popular as a breakfast was really an irony. And someday we will laugh about this Kellogg cereal as we laugh about lobotomy. Thank you.
Completely agreed.
Very good.
Thank you so much.
I think as serotonin and other neurotransmitters have been identified, I think many needs to be identified in future, because brain functioning is essentially a chemical action, and more chemistry we know about functioning of brain, we will better understand mental illnesses.
Absolutely. Very true. So very true.
So how is the progress of psychiatry in India, Rumin? I mean, do we have enough psychiatrists or we are still lacking in the numbers of psychiatrists?
The ratio of psychiatrists in India is abysmally low. There is a reluctance from patient to accept psychiatric illnesses, but public psychiatry or
Community
psychiatry,
yeah.
community psychiatry is not so practiced, but there is a dearth of psychiatric facilities in India in general. We have still not reached. Drugs are available, everything is possible, but the ratio is still low.
Any other comments or questions from anybody? Okay. So if there are no questions, we are right in time. It's 9 o'clock. So we end the session here. Thank you very much, Rumin, again, for sparing your time at a very short notice. So thank you so much. Thank you. Thank you all. We meet
Thank you.
next Saturday. Again, we will have Dr. Arif Ahmed. He will be speaking about allergies. He's from Hyderabad, and we had him as a guest speaker in the past also. So we meet next Saturday morning again. Thank you all. We end the session. Thank you.
Thank you, all of you. Thank you.
Thank you.
Thank you.